I'm Dr. Jason Siegel, and welcome to Neuro Now. This is a segment that I hope that we can do on a regular basis, and it's a question and answer segment where we get a lot of questions either directly to us or through email or through any of our social media platforms on Instagram, Facebook, Twitter, YouTube, um, and they're questions about neurology, they're questions about the practice, and I thought it'd be nice to again on a regular basis pick some of these questions and answer them for other people out there who might also have questions. So what I'm going to do here is answer a few questions. These are real questions from real people. We're not making any of this up, and hopefully you learn a little something. If you're interested in asking a question for a future episode, you can email us at office@yourneuronow.com. You can follow us on Twitter, on Facebook, on Instagram. Of course, you can write a comment or a question here in the YouTube comments below. So without further ado, here are our questions. So the first question comes to us from Indiana, and the question is, what types of things can you help with? So I'm a general neurologist. I'm board certified in general neurology. I did do special fellowship training in neurocritical care, spending most of my professional life in a hospital seeing strokes and hemorrhages, aneurysms rupture, people who have seizures to the point where they need to be put in a medically induced coma for them to stop. But I got really interested in what happens to those patients afterwards and what's the follow-up like for those patients, and what does brain injury recovery really look like. In the modern world, we're also dealing with people who've had COVID, who have long COVID symptoms and post-COVID neurological syndromes, and they have a lot of issues that we see a lot in the neurology clinic: headaches, fatigue, cognitive changes, confusion, numbness and tingling in their arms and legs. And so truthfully, some of this stuff we're still trying to figure out, but a lot of it is pretty routinely seen in neurologic clinics. Other diseases that a neurologist sees: epilepsy, of course, headaches, memory loss, Parkinson's and tremors, autoimmune inflammatory issues like multiple sclerosis and other autoimmune inflammatory issues, peripheral neuropathy, and issues of the nerves and muscles. The next question comes to us from Florida. The question is, what is telemedicine and why use it? So telemedicine is a broad umbrella term for anything that incorporates technology into helping patients and in healthcare. The primary way we will use telemedicine is via two-way video audio visits, similar to Zoom or FaceTime or any of the other ways that you might have been communicating or having meetings in the last 2 years since we've all been on lockdown. We use what we call asynchronous telehealth as well, and that is you uploading your vitals. Again, we have an EMR that allows us to upload Apple Watch health information and Apple Health information. And so that's not necessarily real time, but it's a part of a way for me to be as comprehensive as I can in understanding your health situation. Why use it? Well, I think it allows us all to be a lot more flexible in our daily lives. It allows you to be seen by me without having to take a whole day off work so you can still go sit in a waiting room. We have very good results using telemedicine. Neurologists have been using telemedicine for decades to evaluate acute strokes in emergency departments with very good results. So it's a good system. It's a system that leads to very accurate diagnoses and very good management plans, but also allows the patient to have a lot more freedom, a lot more flexibility in their lives and the way they see doctors. This next question, the last question, is great. It's a question that for years in our ICU, when we interview new doctors, new nurse practitioners, new residents and fellows, we would ask to try to get a sense of who they are and their personality. So I thank the person who asked this question. The question is, if Dr. Siegel could be any Marvel superhero, who would it be and for what reason? And honestly, for me, this doesn't take much thought at all. For me, the answer is Thor. Why? Well, Thor has a very cool hammer. As a neurologist, we like our very cool reflex hammers, our very cool hammers. Thor and I both have outstanding facial hair. I think that if you look at Thor's journey over the last 10 years, he has a lot of personal growth. He's really changed from the first Thor movie to the most recent one. And I like to think that over the last 10 years, I've had some personal growth as well. So for those reasons, I would pick Thor. He's my favorite superhero. Certainly my most favorite Marvel superhero. So that wraps up our first question and answer mailbag. If you want to see more of these, go ahead and like and subscribe and hit the bell for notifications. Please ask us questions. It can be anything about our practice. It can be about neurology. Maybe you saw a news article or a news broadcast or something on social media about a neurological topic you want more information about. I'll try to answer those to the best of my ability. Um, Follow us on all the social media outlets. Again, Instagram, Facebook, Twitter, YouTube here for more content. We really appreciate you. Thanks a lot. I'll see you next time.